Hey everyone, Sarah here to talk about the Behavioral Health Bootcamp and some of the major takeaways that I had from that day. One of the major takeaway points from the bootcamp was the lack of confidence and training that we keep finding in our primary health um, care providers when it comes to diagnosing and medicating patients with mental illness. In our integrated health care segment, Dr. Caraway stated that 40% of people with chronic disease also suffer from mental health illness, and 67% of psychotropic meds are prescribed by primary care providers. I thought that was pretty crazy when we think about how little training and confidence that these primary care providers have when it comes to diagnosing these patients. And she kept talking about how they were asking her what medication to prescribe and what her thoughts about the diagnosis were. And I just thought it was, kind of insane that almost 70% of these medications are being prescribed by our PCPs. So I think definitely the stigma surrounding mental health is causing people to go to their primary care provider instead of a mental health professional. And then also she talked about the comfort of seeing your primary care provider and the convenience. And she also talked about how sometimes your family doctor feels like part of your family, and you're way more willing to talk to them about your needs and your problems rather than talking to someone that you might not know or that feels like a stranger. So definitely as a counselor, we have to be very aware of who prescribes our patients medication, and then also, how often are they following up with these doctors, and are the doctors aware of if they're taking the medications or not. So that was my first takeaway. The second one was when Dr. Caraway was describing the dynamics at family medicine and how it kind of works there and who sees who and when. And she kept repeating that she would tell the behavioral health students to stay out of the way of the medical students and the doctors, and to be so respectful of them because they have their own culture, and even that you should be calling the residents and interns doctor. And I just thought it was so crazy that she would even have to say that, to stay out of the way. I mean, that kind of, I guess, goes against with everything we're trying to do with integrated healthcare. And I know it's not her fault, and it's, I guess, the stigma of mental health in our society. We don't view it as important, and behavioral health is important as our medical physical health is. So I just wonder if we'll ever see a day when the medical student supervisor will tell them to stay out of the way and be respectful of the behavioral health providers. And it just bothers me that she has to say this. Sorry, it's my dog. It bothered me that she had to say it, and I hope that we see a day when we can have integrated care and everyone is seen as being valuable and important. The last thing that I took away from the boot camp was during Dr. Caraway's behavioral medicine presentation. She was going over the different acronyms and all the different words that we use in behavioral health and primary care, and I didn't know a lot of them. I was, people were shouting them out, and I was kind of going, oh, I don't know these. I mean, I can guess, but I'm not really sure. And it made me think, like, how must clients feel when we're talking to them in, exam rooms or counseling offices, and we're just throwing these words out, and they're just sitting there thinking, I don't know what any of this means, and they might be too scared to ask. And I thought about, being a teacher and being in these IEP meetings, and you're throwing out all this lingo, IEP, 504, behavior plans, and parents are sitting there lost in translation, and I think our clients probably feel the same way sometimes. I think that we've, as counselors, we've got to do a better job. We've got to put forth a better effort of explaining, what we're doing and why exactly we think it's a good plan. And, Dr. Caraway said that she had a client who had been diagnosed as being diabetic for, 7 years, and no one had ever explained to him what diabetes was. And I thought that was insane. So I think as counselors, we got to do a better job. Put your best foot forward with the client and say, here's what we're doing, and here's why.